Hello, my name is Dr. Shamiza Ali, and this is my colleague, Dr. Rosa Tavares at Urban Health Plan. Urban Health Plan is a network of community and school-based health centers in New York with locations in the Bronx, Corona, Queens, and Central Harlem. We are here to wish you and your family a healthy, happy summer, and we hope this video chat finds you well. Let's get ready for school. It's been said that education is the best weapon to change the world, said Nelson Mandela.
I think we need to discuss with parents how important is it that we start again getting our kids into routine. What do you think?
So I think routines are very important, especially during the pandemic and the summer months. Some kids have been going to bed really late and waking up really late. So regardless of how back to school will look for your family, whether it's heading out the door, getting on a bus or walking to school, or logging in at home, please start planning now with getting to bed on time, waking up on time, and you as a parent know your child best. So if that takes about an hour from waking up to brushing teeth, getting dressed, and eating breakfast and logging in, start planning that from now on.
I think it's also that we discuss how are we expecting our kids' day to look like? How is it going to look like this going back to school on a regular day?
So a regular day in this pandemic times will look a lot different than it did last year. So in a day of a life of a student, whether you're heading out the door, it involves, again, getting ready and getting your backpacks on and being prepared with your face mask to stay safe in the community. And whether it's working from home, it requires parents setting up their learning stations at home from now. Pick a nice, comfortable table that's big enough if you have more than one child for all the children to be able to spread out with their laptops, their books, maybe something like a dining room table with comfortable chairs, and to start thinking about where you're going to be doing your remote learning online. So pick a comfortable space, clear out clutter. Now is a perfect time to get rid of clutter and get that space functional so you can succeed as a family learning from home.
Perfect. That sounds amazing. And there is something also that I think is important. It's that this is all different. How do you think that we can encourage our kids to talk about how they feel in this new situation?
So the pandemic is a very stressful, a very different time for all of us. And talking about feelings, mental health check-ins, that applies to both the children and the parents as well. So I would recommend starting something like a journal, talking about feelings. And there's also a good resource online that's available on YouTube to teach little kids about the importance of social distancing. And it's called Time to Come In Bear by Kim St. Lawrence. And it's a really short, sweet video. It's about a minute and 40, under 2 minutes, and it's really worth the time to watch with your children to teach them the importance of why we need to wear a mask and about keeping our distance and hand washing and keeping each other safe. So I really do recommend that. I actually learned about this resource at a meeting that I listened to over the weekend from the New York State PTA. So it's available to listen to on YouTube, and you can please check that out. And also doing mental health check-ins with parents as well, and talking about the pandemic and learning about what it is, and to really choose facts over fear, and to learn about the history, the 1918 pandemic. Our ancestors went through that so that we can live here to talk about it and live through our pandemic. So please share with the kids about the importance of wearing a mask, and try to make it normal, like why we have smoke detectors to keep us safe, why we wear seatbelts in a car is to keep us safe, and why we promote wearing helmets when riding a bicycle is to keep us safe. The same way, wearing a mask during this pandemic will keep us safe.
Perfect. That is very important. And this is like $1 million question. Should we take our kids outside? What do you think we should pack when we are going outside with our kids or to go back to school?
So we should absolutely go outside. The American Academy of Pediatrics actually recommends doing a lot of nature play with children. So if you were to ask me about 5 months ago when the pandemic was first declared, we would have said, please stay home, stay safe, as per our governor's guidance and advice. But now that things are better controlled in New York, we do promote going outside, getting sunshine, vitamin D. With the pandemic, a lot of our community members have gained weight, and it's been contributing to obesity, childhood obesity, due to lack of physical activity and the nutrition. So we do promote going outside to keep kids mentally healthy and physically healthy. And while you're outside, you could do things like nature observation, nature play. It doesn't have to involve using playground equipment that may be frequently touched. And to keep yourself safe, we do recommend like taking a walk, talking about plants, teaching kids about, like what a plant is, simple things like that. What do plants need to survive? So you can make a science lesson out of it. And when you get home, you can draw the parts of a plant again in your journal and learn that way as well. And you can pack your own grab and go bag, maybe have a frisbee, a soccer ball, a kite, use your imagination. And those are your belongings. So you just simply grab them up in a bag and you take them back home. And speaking of your grab and go bag, I have right here, like what a backpack may look like for this year. So in your child's back to school backpack, which can also be your grab and go bag, you can start stocking up now on hand wipes that are alcohol based. And so be careful with hand sanitizers. We do recommend using hand sanitizers when you don't have access to running water and soap, but be careful now with the toxic ones that have methanol in them. And they are a list on the FDA website of wrong names to stay away from. So pack your hand wipes, your hand sanitizer, take your water with you, and don't forget, of course, to pack extra masks. And so for back to school, if your child is going in person to learn, you will want to definitely pack extra masks. And I recommend something simple like a pouch where you have extras because, kids may drop their mask. It can get soiled. It can get wet or dirty. So you can have the cloth mask or you can have the ones with the loops. And then you have one pouch where the clean ones go in and you can label it clean on the outside. Maybe a label maker or a Sharpie or something like that. And then you have another one for dirty or soiled, and you can just have teach your child to put the dirty, soiled mask into a separate pouch that will get washed. And that goes back into the backpack. And that's how the new backpack is going to look this year, or your grab and go bag, for outside. So besides your crayons and your notebooks and pencils, you also have this prepared for the pandemic.
Definitely well prepared. And for those parents that choose to do part of their homeschooling home and they work from home, how do you think it will be best to manage this duality? Because it's definitely a challenge.
It definitely is a challenge, and I can speak from personal experience that I've been working from home some days for about the past 3 or 4 months, and it really takes a lot of planning and thinking ahead, and things like meal planning. So when things ramp up back in September, really start thinking about preparing breakfast, snacks, lunch, what you're going to serve, so you're not cooking on the spot, and preparing your workstation as well, and making sure that is conducive to your work so you can be productive for your employer. Also start thinking about childcare from now. It really will take a village to raise our children. So if you can rely on the help of a trusted neighbor or family that are healthy, please start looking into that, or how you're going to help your child succeed with learning from home and also working from home. So again, it takes a lot of planning and clearing out, your space so you can be successful as a family.
That's a great idea. So one of the things you mentioned before was the use of masks. That's something that we have to, from now on, use every time we go back to school. And it's very important that we remember this, because this is what's going to help us stop the spread. Stop the spread of COVID-19 and also many other diseases that we might encounter. It protects those that are at higher risk to getting sick. It protects those essential workers like me and Dr. Ali and all of our co-workers here at Urban Health Plan, and also all of those employees in the supermarkets, the people that clean the streets for us, firemen, policemen, that are exposed to this virus on a daily basis, because that's our job. Also, we have to remember that the use of masks works if we all do it. If it's widely spread use in the public, then the things are going to work better. Obviously, we have other methods to try to help with the pandemic. Is social distancing, that we've been talking about, cleaning, and hand washing, and hand washing over and over again, so we can try to avoid this virus coming to ourselves and our families.
So, Dr. Terrell, as you mentioned, thank for the importance of wearing the mask, and it's super important for everyone to understand why we're doing this. And can you tell us a little bit more about, again, who needs to wear a mask? Can we emphasize who needs to wear a mask?
Mostly everybody needs to wear a mask, especially those over 2 years of age. In little babies, less than 2, it's a little bit more difficult, and they're going to be touching their face too much, so they won't be able to keep themselves safe, because it's going to be more risky. We also have to consider those patients with special needs that might need to get around the use of masks. Patients, for example, with hearing impairment, that they are depend a lot on lip reading, then they might need to be creative on the mask if they use them, to make it sure that they can see the mouth, or try to use one of those face shields, because it's difficult for them to communicate. Also, they can use, for example, reading communication. Obviously, there's some other cases, patients with intellectual disabilities, developmental delays, and that might be difficult to wear a mask, and it might be risky, the same as the kids under 2, because they're touching the mask, because they have some sensory issues. And in those cases, then the parents will have to talk to their pediatricians to come up with the best idea to protect them. But mostly everybody needs to wear the mask. And we have to emphasize in these kids this particular use. In the cases that we cannot encourage the use of masks, because as I mentioned before, the kids will be touching their faces a lot, then we'll encourage them to keep social distancing and try to teach them why is it important. Obviously, there's occasions that we cannot keep them separate. For example, on carpools where they're going on a bus, then we have to teach them why in those special situations it's important to have their masks on.
Great information. And I've seen lots of different styles and type of masks. Can you tell us more about what type of mask someone should wear?
So it's definitely many type of masks. You saw me and Dr. Ali with the mask that we use, the surgical mask that we use in the clinic, that those should be reserved for the people like us that need it the most. But there are many clever ones. There are, like, for example, these kit ones that we can use. This is one of my sons. And this is, for example, this is one of the ones that I use outside of the clinic. So the most important thing we have to remember is how the mask needs to fit. Because if it's not fitted, then it won't protect anybody, not us or anybody around. So the mask has to cover, I'm going to show you. It has to cover the nose and under the chin and on the sides, okay? To make sure that we actually have a good protection. And you see what I did there? To take it off, you gotta make sure that you do it properly so you don't get contaminated. So putting it out from your ears with the loops and folding it and put it in that side, okay? That's super, super important. And there's also many other ones, like this ones. There are most of them cloth ones, and there are ones that have like a little filter. You have to be like the air breather. You have to make sure that those ones you put one of these filters on, because if not, it won't protect you or the people around you. So that's what we have to remember. So we have to reserve the mask, the N95 mask and the surgical mask like this one, for the people that are higher risk, for the essential workers and those patients, for example, that have immune deficiency or that get sick easily because of any other condition. Then those patients, we have to reserve the N95 and the surgical mask for those people.
And Dr. Taveras, I've seen some folks wear their mask kind of like below their nose. And can you comment on that? Like they'll talk through their mouth.
That's why it's important the fit, okay? Cover your nose, under your chin, and on the sides of your face.
So I've seen them hanging out. So I remind them constantly to pull up your mask, and I
know.
tell them that if their nose is exposed, they can potentially, like even breathe in or breathe out germs and infect others. So no matter if their mouth is
Exactly.
covered, it's important to wear it correctly, right?
Exactly. That's super important. It's definitely super important.
Okay. And how do I clean a mask? Like, what would you recommend?
So for cleaning, it's very simple. The cloth mask, we have to clean it with a regular washing machine with the rest of our clothes if we choose to. If you want to do it by hand, then it's recommended to use a bleach, household bleach. You can do 3 to 4 teaspoons on a quart of water. The hotter, the better. Obviously, be careful not to burn yourself. Then you soak the mask maybe between 5 to 10 minutes. That's what's recommended. And then after that, you rinse it with the cold water very thorough to make sure that there is no residues of bleach in the mask, so you don't get any intoxication. For the drying part, you can either do the dryer machine. If so, it's ideal that you use the hottest setting possible, and if you do it air drying, it's also available and it's cheaper, and you can do it by hanging it, but you have to make sure that it's completely dry, and if it's possible to expose it to sunlight, even better. And that is super important also.
And then what would you say to a parent if they ask you for tips if their child cannot keep a mask on or wear it?
Definitely, we teach by example. So if they see us wearing the mask, then they will wear it. It's important to explain to them why are we doing this? What is the importance of using the mask? That we need to protect them, the people around us, the people we love, and also to protect ourselves. As I said before, they learn by watching us doing things, okay? So we can teach them in different ways. We can, for example, use one of their teddy bears and put a little face mask on them so they can see it. We can put them in front of a mirror so they can see that there's nothing to be afraid of, that is himself just with the mask on. And as time goes by, I think that kids are smart enough and they will get used to the idea that this is something normal from now on, a new normal that we all have to get accustomed to. So definitely by teaching them that way is the best options that we have. In kids, little kids like under 3, it's difficult to give them a good explanation or like a proper explanation, I would say, on the reasons behind the mask wearing. But in older kids, we can tell them, there's germs around, there's good germs, bad germs. So we have to protect you and others against those bad germs around us that are here and they can harm your family. And I think that they will be able to understand these things very easily if we explain them and if we teach us, again, by example. If we're going grocery shopping, put the mask on. If we're going outside to do any errands or just to toss the garbage, that's the way they're going to see the importance of wearing a mask.
Absolutely, great tips. And then I myself had my mask on at work now for about 5 hours. Is there anything that for children that they can use to make wearing their mask more comfortable?
Definitely. There are a few clever ways that I've found online for that. And I found these little holders that you can put behind the head of the kid right here and hook the mask on in the loops right here. I hope you can see it well. It is definitely clever and it's not going to harm the ears of the kid. For other ways also, I found these headbands. This one is white, it's kind of hard to see, but there's a little button right here that you can hang up the loops of the mask around it, so it doesn't hurt your ears either. It's very, very smart, very clever. There's so many ways. I just saw a hat also over the weekend with the little buttons on the side. It's incredible how people are becoming more and more inventive with these things. I guess everybody's getting used to this new normal, right?
Yes, absolutely. Anything to make it comfortable to keep wearing, and that's the main thing, to keep it on and wear it to keep us safe and healthy.
Definitely so. So I hope this conversation has been enlightful to all of you. I want to remind you that here at Urban Health Plan, we're all here to help you. We have available telehealth visit and in-person visits when needed. We're going to put the phone number for you to see so you can call for an appointment either in person or by telehealth. I hope this talk has been, as I said before, enlightening and you can find it online. And I hope your family is safe for the days to come in this new normal life.
Yes, we hope this message has been helpful in helping you make a decision about getting back to school. And we look forward to seeing you whether in person or by telehealth visit.